All right. Hey, everyone, and welcome. If you're heading into nursing, especially anything to do with OB, you've got to know that postpartum care is, well, it's way more than just a recovery phase. We're talking about a massive transition, not just for the patient, but for their whole family. And guess who's right there in the middle of it all? You are. You are the guide through this amazing and, yeah, sometimes really tough journey. So let's get right into it. So, first things first, we need to kind of flip this script on how we think about this. Most people think childbirth is the big finale, right? The finish line. But for our patient, for their body, for their new family, it is absolutely the starting line. This is what we call the fourth trimester. And our job, our number one job, is to make sure they get through it safely. Okay, so here's what we're going to break down today. First, we'll get a solid definition for this whole fourth trimester thing. Then we'll look at the incredible physiological reset the body goes through. After that, we're diving into the big one, your go-to assessment tool, BUBBLE-HEE. And finally, we'll wrap up with the super important discharge teaching that keeps our families safe once they go home. All right, let's kick things off. What exactly is this fourth trimester everyone talks about? You know, the fancy clinical term is the puerperium. Basically, it's those first 6 to 12 weeks after birth. But I want you to think of it less as a period and more like a total system reboot. And the word to remember here is dramatic. This is not a slow, gentle coast back to normal. No way. It's a super fast, system-wide transformation that hits everything. Hormones, blood volume, mental health, you name it. So let's talk about that reset. It literally kicks off the second the placenta is delivered. That's the trigger. The body immediately starts this huge physiological shift. And the command center for this whole operation, it's all about the hormones. And check this out. The speed of this change is just wild. The two big pregnancy hormones, estrogen and progesterone, they just fall off a cliff. And that massive drop in estrogen is what's behind all that peeing and sweating you'll see in the first few days. That's the diuresis and diaphoresis. It's the body's way of ditching all the extra fluid from pregnancy. At the exact same time, you've got oxytocin surging to clamp down the uterus and stop bleeding, and prolactin ramping up to get milk production started. It's like this perfectly timed hormonal seesaw, and the effects are immediate and powerful. Now, this whole hormonal dance is absolutely crucial because of what's happening with blood. Think about it. A patient can lose up to 500 milliliters of blood in a vaginal birth. That's about the size of a pint glass. For a C-section, it can be double that, up to a whole liter. So, how does the body not go into shock? It's actually genius. During pregnancy, the body prepped for this by jacking up its blood volume by a whopping 40 to 50%. It literally created its own safety net, a protective buffer just for this moment. So where does all that extra fluid actually go? Well, here's your answer. You might see a patient putting out up to 3,000 milliliters of urine a day in those first few days. Yeah, 3 liters. That's more than a big soda bottle. This huge amount of peeing, what we call diuresis, plus a lot of sweating, is just the body's super efficient way of getting back to its pre-pregnancy state. It can be surprising to see, but it's totally normal and exactly what we want to happen. Okay, so with all this crazy stuff happening all at once, how in the world do you keep track of it all? How do you make sure everything's on the right track? Well, you need a roadmap. And for us postpartum nurses, that roadmap, our secret weapon really, is BUBBLE-HEE. I want you to burn this mnemonic into your brain. BUBBLE-HEE is your key to doing a solid, efficient, and consistent postpartum check every single time. It's like a special postpartum head-to-toe that makes sure you cover every single important system, from breasts right down to emotions. It's designed so you literally can't miss anything. Let's walk through a couple of the really critical parts. All right, checking the uterus, what we call the fundus, is one of the most important things you'll do right after delivery. We're checking 3 things. Is it firm? Where is it located? And how high is it? But I really want you to focus on step 2 there, supporting the lower uterine segment. Why is that so important? Because if you just start massaging without that support, you could literally cause the uterus to turn inside out. That's a uterine inversion, and it's a massive life-threatening emergency. So that one simple hand placement is an absolutely critical safety measure. And this right here is a perfect see it, do it moment in nursing. If you put your hands on that fundus and it feels soft and squishy, we call that boggy. That's a huge red flag. It means the uterine muscle isn't contracting. It's not clamping down on all those open blood vessels where the placenta used to be. That's called uterine atony, and it is the #1 cause of postpartum hemorrhage. So your first move, your only move, is to get your hands in there and massage it until it's firm. You don't ask, you don't wait, you just do it. It's a life-saving reflex.
Next up is lochia. Think of it as a progress report for how the uterus is healing on the inside. It's supposed to follow this very predictable color change. It starts as rubra, which is dark red, then it transitions to serosa, a pinkish brown, and finally it ends as alba, which is a whitish yellow. Now, if you see it go backwards, say it was serosa and now it's back to bright red, or if it has a foul odor, that's your alarm bell. That's a big sign that something's wrong, like a late hemorrhage or an infection.
So what about healing on the outside? For any kind of perineal repair, like from an episiotomy or a tear, or even for a C-section incision, your best friend is the Rita scale. It's another awesome mnemonic that gives you a totally systematic way to check for infection or healing problems. You just go right down the list. Redness, edema, ecchymosis, which is just bruising, discharge, and approximation, meaning are the edges of the wound coming together nicely. Using Rita means your assessment is always objective and you won't miss a thing.
Okay, and the last E in BUBBLE-HEE stands for emotions, and this is a huge one. It is so important that we know the difference between the postpartum blues and actual postpartum depression. The blues are super common, affecting most new moms, but the key is they're temporary and they go away within about 2 weeks. Postpartum depression, on the other hand, sticks around. It gets worse, not better. And here's the critical difference. It gets in the way of the patient's ability to care for themselves or their baby. Knowing this difference is what tells you when to just offer support and reassurance and when you need to get them professional help, ASAP.
Now, our job doesn't stop when those discharge papers are signed, not even close. You could argue one of our most important jobs is making sure that family is empowered with the right knowledge to be safe when they get home. And that's all about our discharge teaching.
This right here is non-negotiable. Every single patient, every partner, every support person needs to have these warning signs drilled into them before they walk out that door. Each one of these points to a potentially deadly complication: a fever, infection, heavy bleeding, hemorrhage, a severe headache, preeclampsia, calf pain, think DVT, chest pain, pulmonary embolism, and you have to make it crystal clear. These are not let's wait and see symptoms. These are call 911 or your doctor right now symptoms. Seriously, the information on this slide saves lives. And really, that brings us to the most important point of all. Yeah, you've got to master the clinical skills. You need to be able to do a fundal massage in your sleep and know Rita backwards and forwards. That's the science of our job. But postpartum nursing, it's also an art. It's about looking past the tasks and seeing the bigger picture. You're not just taking care of a uterus or a perineum, you are caring for a brand new family, right in the middle of one of the most vulnerable, incredible moments of their lives. So remember, stabilizing the body, that's just step one. Supporting that new family, that's the whole game.